Come in.
Hi, Renee.
Hi.
The nurse asked me to come in and provide mouth care for you, okay? I'm going to get the supplies and we'll get started.
Okay.
All right. All right, now we're getting ready to do the skill of mouth care. Now, as you can see, once again, we have the supplies laid out here for you on the table. You have your emesis basin. You want to make sure, of course, you have a fresh toothbrush and your toothpaste. You want 2 cups of cool water. One is, of course, to moisten the toothbrush itself, and the other is for her when we get ready to rinse her mouth. And then, of course, we have our gloves for infection control, and then we have our clothing protector. So now we're going to move our supplies over by the bedside. Again, there are some things that we have to do prior to actually starting to brush your teeth. Now, one of the things you want to make sure of is when you're providing mouth care, that you provide mouth care entirely, which includes brushing the tongue. So please don't forget that. That's one of your critical steps, as you see in a moment going up the screen, the different color skill. That critical step says brush the entire mouth, including the tongue. Okay? So now I'm going to demonstrate how we do that. All right, the first thing I want to do is sit Renee up in a sitting position. And again, we want to make sure she's at least 75 to 90 degrees. And you know we're going to take the bed all the way up to 90 degrees to make sure she's in an upright position. All right, Renee, I'm going to let your head up, okay?
Okay.
The bed remains in a low, safe position, but we're going to raise the head of the bed. And again, of course, the purpose of doing that is so that she don't aspirate. Okay. All right. I'm going to bring the table over a little closer to her so that we have the supplies are ready and available. I'm going to go ahead before I actually start to brush her teeth. I'm going to put the clothing protector around her again. Okay. Before I actually start brushing, we're going to make sure that we put our gloves on for infection control. And the paper towel, again, is a barrier just to keep things so that we can maintain infection control. We're going to go ahead and open up our toothbrush here. Get our toothpaste ready. Now we're going to go ahead and moisten the toothbrush before we actually start. You definitely don't want a dry toothbrush going into your patient's mouth. We're going to apply some toothpaste. Just a small amount onto the toothbrush. All right, and now we're going to start to brush your teeth. And so, Renee, if you would just open up for me. And it doesn't matter where you start. You just want to make sure that you brush your teeth all over. You want to also make sure that you do all areas. You want to be gentle. You definitely don't want to be too rough on your patient. And remember, the evaluator is watching everything you do. If you could just put your teeth together for me. Okay, you'll come open up for me and put them together again. Thank you. Okay, if you'll put them, there we go. Can you open up for me? I'm going to get inside your teeth. We're watching in regards to making sure that we brush all areas. Okay, now if you just stick your tongue out a little bit for me. You don't want to go back too far because you don't want to hit that gag reflex. But you want to make sure that you brush your tongue. You okay? Mm-hmm. Now we're going to take our emesis basin and hold up. And you're fine just as you are. If you take a little water and swish it around for me. And then you want to just go ahead and release that into the emesis basin. There you go. You want to make sure that you wipe their mouth. Okay, do you need to rinse a little more? Mm-hmm. Okay. Swish that around. Ready? Okay. Is that enough? Mm-hmm. You want to make sure that you wipe their mouth. And always wipe up under their chin, just in case. All right. And we're going to just take that off. And now what we're going to do is go over to the sink and discard everything. And we're going to rinse out our emesis basin as well as get rid of our clothing protector. And we'll come back to Renee in a moment. Okay, now we're going to come over here and we're actually going to go ahead and dispose of everything. So the first thing we're going to do is we're going to actually rinse out our toothbrush and our emesis basin. Now remember, you want to empty, rinse, and dry. So you want to make sure that you do all 3 of those steps, because that's part of that steps in order to get credit. So we'll rinse it out. Make sure that we dry it out. And as you can see, your step says place the toothbrush inside the emesis basin. Usually you keep that in your patient's room. I'm going to place that in a designated dirty supply area. I'm going to go ahead and get rid of our other supplies here. We're going to place our clothing protector in the dry linen barrel. Now, one of the things you notice that I did not remove my gloves prior to doing all that cleaning and removing the linen. So you want to make sure your gloves stay on. Now, at this point, you're ready to take your gloves off. So you're going to go ahead and take your gloves off. Throw them away. And then you'll say to the evaluator, I would wash my hands. Now, we're going to go back over because we still need to complete our skill with Renee. Okay, so we're going to come back in here to Renee and get her situated. Okay, so we're going to let her head back down. Okay, because we want to, again, make sure that the bed is in its lowest position. And that she's safe. Okay. And now we want to make sure, of course, that her call signal is within reach. Renee, here's your call signal. If you need us, just give us a call, okay?
Okay.
And now the skill is complete.